That's called stick to it, right there. I've floated about 43,000 horses now, according to my count. And so I've stuck my hand in 43,000 horses, and I usually stick it in 2, 3, 4 times per float. So that's about, I don't know, getting close to 200,000 times I've stuck it in a horse's mouth. And I've never had any problems with it. I don't recommend that you stick your hand in a horse's mouth if you're watching this. Please don't do that until you get proper training. They can crush your fingers off. They can do a lot of damage. Sometimes these horses are so sharp that when you stick your hand in and pull it out, they've actually cut your skin. That's how sharp they can get. So be very careful. If you want to do something like this, please get somebody who knows what they're doing to teach you. I think I'm going to back out and you can film the rest of this. Oh, she's done.
Are razor sharp? Yes, they are.
Specific about front teeth, is there any sort of thing you want to address about that?
Sure. The question is, what do we do for the incisors? The incisors are also commonly known as the nipper teeth, the front teeth that you see here. The front teeth are made up of a softer type of enamel, and this is according to Dr. Patty Dixon from the University of Edinburgh. The enamels of the back teeth are harder. A lot of dentists are making a big deal about the front teeth. You see a smile, in other words, it curves this way, or you see it sheared. In my opinion, that's all secondary to something that's happened in the back. And if you take care of the back teeth, the front teeth will take care of themselves. I do not believe in touching the incisors as far as aligning them. A lot of dentists will say that you need to take care of the first teeth, the nipper teeth first, and that will balance the two joints back here, the temporomandibular joints, and allow the teeth to come together. And then they talk about occlusion of the cheek teeth, and if you take too much of the cheek teeth down and the incisors are too long, the back teeth can't come together. And I'm like, I have trouble believing that, and I'll tell you why. First, my rear teeth don't come together when I chew. When I've got a piece of meat or a mouthful of salad, and I'm chewing, they don't come all the way together. They don't pulverize it into a powder. The purpose of chewing is to organize the food that's in your mouth into a bolus so you can swallow it without any interference. It's to add a little bit of saliva for lubrication, to break and crush the outer areas so the digestion will work a little bit better. But I've seen plenty of horses, I mean hundreds and hundreds of horses, that have one tooth here, and maybe 6 teeth total on the other side. So they only have 8 teeth instead of 24 teeth back there, and they're fat and happy. The studies have shown that as long as the food gets from outside past the gullet and gets down here, these horses can digest their food. So I really have a tough time understanding with so many horses that don't have good teeth, and they're fat and happy, why we have to try and get the grinding teeth to come together. It just doesn't make sense to me. They spend a lot of time trying to balance the front teeth and the back teeth, where in reality the horse is happy. They remove all the pain because they remove all the sharp points. And of course, a horse goes better because they remove the sources of pain. So there's been no good scientific study in any literature that I've seen, nor in any of the textbooks that I've read, that convinced me that taking the teeth off up here makes a difference. And in fact, there have been multiple cases of horses who have gone through the incisor reduction, and these horses have actually died from the procedure because they get too low, they cut into the sensitive areas, and the teeth get infected, and the jaw gets infected, and the horses have literally died. And this has been documented in many vet clinics. So I'm not the type of person who wants to do a procedure that may cause the death of a horse. In 27 years of floating teeth, I haven't killed one horse yet from the floating process. In addition, I want to make sure the horses eat. One of our pet expressions is, when we're done, we close the door and we look at the horse and they're eating. That's the goal. If your horse doesn't eat for a day or a week or a month, I mean doesn't eat, I can understand they can be a little, where do the sharp points go? They tilt their heads. Sometimes the food falls out as they try and reorganize and figure out where their teeth, the sharp points are. But if they're not eating after floating, then I think something wrong has been done, and that process was not the best for your horse. That's it.